Here's the introductory letter. I am a survivor of sexual assault. My biological father molested me and raped me from the grade 3 to grade 6. I just want to stop right there. That is a huge change, right? You lost your sense of safety. You lost your sense of what sexuality and sexual experience and intimacy and love should look like. Everything changed for you in that moment.
I am mentally strong, learn it, live it, level up, regardless what life brings. I will live mentally strong.
Have you ever wondered if it's your trauma or it's an actual mental health diagnosis? This happens a lot with people who have experienced, especially childhood trauma, when they begin to experience symptoms of depression, anxiety, maybe even bipolar. It's like, was it the trauma that caused this? Or, is it really a biochemical problem going on in my mind? The Mentally Strong method is a real good way for you to be able to organize the multiple things that are going on in your thought process right now. The Mentally Strong method was created by me, I'm Dr. B, in the midst of severe grief and trauma. Even though I'm a psychiatric nurse practitioner, those tools that I learned did not actually help me when I was in the midst of grief and trauma. And so I created what I call a Mentally Strong method, and it allows you to take those thoughts, all that chaos that's going on in your head, and put it into manageable choices and help you to organize, what is this trauma doing in my brain? What can I do about that? And is this a mental health diagnosis that I need, maybe professional intervention for, or I need to at least address it, right? So I want to share a very specific story of someone I'm working with. And this is important because oftentimes you'll watch a video and it'll be about depression or anxiety or bipolar. And it's like talking about it as a disorder. And there's just so many factors. And this is how the Mentally Strong method actually helps you put those factors into, easy choices, or nothing's easy in mental health, but choices that you can be proud of. And every person with depression has different things going on. Every person with anxiety has different things. Even though in the medical community, we kind of diagnose based on a cluster of symptoms, and we understand a little bit of the biology that's going on behind that. Each and every one of you who is struggling, it's the why, the stuff behind it is all different. So I'm going to take the time today of going through a very specific story to help someone I'm working with. Okay. Here's the introductory letter. I am a survivor of sexual assault. My biological father molested me and raped me from the grade 3 to grade 6. I just want to stop right there. That is a huge change, right? You lost your sense of safety. You lost your sense of what sexuality and sexual experience and intimacy and love should look like. Everything changed for you in that moment. They go on to say, I was unaware of the depth of that change that I'm talking about, right? Mom eventually left this biological father and remarried, had a great stepdad, and so really felt, okay, I'm safe. I don't need to worry anymore about this trauma that I've experienced. Fast forward began to have depression in 2016, and eventually a suicide attempt. Again, I'm going to stop right there. When we get to a point, any one of us, where suicide, hurting ourselves, is an option that we are thinking about, that is the line. People always ask me, because I work a lot with kind of alternative medicine, functional medicine, vitamins, supplements, like how can we optimize? But I also prescribe medication. And when we get to this point, this is a hard line in the sand for me as a provider. You are thinking about hurting yourself, we need a professional intervention, right? Oftentimes medication, and we can kind of juggle that and talk about that as well. But it sounds like that was the first time that you realized how serious this was. And during that episode, I was diagnosed with bipolar 1 and complex PTSD. But I eventually stopped taking the meds because they're not working. Let's stop and talk about those diagnoses for a minute. Bipolar disorder is this kind of severe depression with episodes of mania. Now, mania doesn't have to be, extreme euphoria. It could be mixed episodes of anxiety and overwhelm and agitation. But complex PTSD can also make us very reactive, right? Because you had this period of time between 3rd grade and 6th grade that you did not feel safe for, all the time, right? So this is why we call it complex PTSD, because it wasn't just one rape. It was this period of time of 3+ years of not feeling safe. Okay. And that causes reactivity. So anytime there's an inkling of not being safe, there's this emotional dysregulation reaction that happens with complex PTSD. So is it bipolar 1 or is it complex PTSD? And how do you, look at that and diagnose that and treat that? And this is where I want to tell everyone listening, this is your self-agency. Yes, you should be seeking a doctor for possible medication. Yes, you should be seeking a therapist to, kind of talk through some of that trauma. I teach self-agency. The Mentally Strong method is your formula to know where you're going with these things. So, the story goes on to say, recently I was triggered again, and I'm going to talk about that word triggered again, into psychosis. So in psychosis, this is a break from reality. I would lean towards this is bipolar disorder, right? Because psychosis happens, it is one of the signs of mania in bipolar disorder. It is not common in PTSD. PTSD, we can have dissociative events, but there's not typically psychosis related to complex PTSD. So here we are. Now you have this picture of this adult functioning, doing well to the outside world, right? But inside, this is what's going on, and this is kind of the private story that they're holding. So what do I have them do first? I have them do a thought map. And in this thought map, you take the main feeling and put it in the middle. So here we have depression. And then you ask yourself multiple questions. And I'm not quite sure this was done completely right. Like it wasn't done the way I typically teach it. But that's okay, because it's an exercise of getting out what is behind this depression. And so if you see this here, it starts with not doing enough, right? It's going back on you. Like somehow if you did more, you wouldn't be depressed. Feeling like you don't have a backup plan. Feeling mediocre as a person. Feeling like people are looking down at you and afraid of losing everything. Goes on, the next bubble talks about afraid of being a burden. You know, what if my siblings have to care for me? What if I fail? What if I fail? There's 2 bubbles there about failing. The next cluster is about judgment, feeling judged, feeling sinful, feeling judged by the type of partner you want or how it's working or not working with a partner. The next bubble talks about fear, not knowing my path, fear of hurting other people. Ultimately, it sounds like deep down there's a loneliness, a lack of connection. No one understands me. They won't have me for who I truly am. And that feels lonely even though I'm surrounded by my family. So if you look at this thought map, you can quickly see kind of things that are going on underneath. And if I was sitting with this person, we would go deeper into all of these areas and really flesh out. And I would also ask, like, when did you feel like this in your childhood? How does this impact your spiritual relationship? Because those questions are important. So what does that mean? So what I do in the Mentally Strong method is I begin to take these things apart. And there's 10 categories in the Mentally Strong method. 5 jump out at me right away with this thought map. There's obviously trauma. We know that from the story. But arguably, I think that there's grief, right? There's loss of connection. There's loss of identity. There's loss of like who I am, and did this trauma cause me to now have symptoms of bipolar or depression, or, you know, how does this all work together? And there's a grief of that. There's a grief that this is your story. This is what you are challenged to work through. There's some negative thoughts here. And I bet you everybody listening has negative thoughts. You know, you said, I'm mediocre, not doing enough. And I would dig deeper into that not doing enough. 90% of the people that I work with, their core connection, like what goes deeper than anything else, is that they don't think they're good enough. And so maybe that's what's going on here as well. Behaviors and choices, like accountability to these diagnoses, right? So in the Mentally Strong method, there is a category that's called behaviors and choices. And this is where we have to take self-accountability, personal accountability for what's going on. Could the trauma have kind of been the catalyst for these mental health concerns coming up? Absolutely. We know that. We know that people with traumatic childhoods have a significantly more risk of having a mental health diagnosis. But that doesn't mean you don't treat the mental health diagnosis, right? To be a whole person, we have to take accountability for what's going on in us and what is the best solution for us long term. So I would say right there, there's, kind of some accountability needed for these diagnoses. And spiritual conflict. Like, spiritual conflict is not just, whether you believe in a singular God or not. It is, do you know your purpose? And in this thought map, there was a lack of path. And then really feeling judged by others as being sinful. And this is important because this is the conflict. If you believe what others think is sin and not sin, and you're bringing that onto yourself, and you don't align with that, like that's not who you actually are, then that is creating this spiritual conflict. Like, so part of that would be working through what is sin and what does that mean in my life. So you see how already, and I'm not even sitting face to face with this person, already we've been able to kind of separate these things, right? It's not just about, maybe I have bipolar, I'm going to take these meds, everything's going to be fine. No, there's trauma to be worked through. There's grief to feel. There's negative self-talk that we need to rewire. There's accountability, and there's spiritual conflict. And that's just 5 of the 10 categories that I work with people. So this person asked some very specific questions, and I'd like to get into those. My first question, Dr. B, is what proactive steps can I take to avoid being triggered in my daily life? So you use the word trigger when you went into like, I was triggered and then I had psychosis. That is not the same thing as what in the Mentally Strong method when I say triggered. Triggers are external things that push internal buttons. So, for example, if somebody said to you, you're mediocre, immediately that would push your button of feeling mediocre. And we can't stop that external stuff. All we can do is work on that button, that negative thought of feeling mediocre, so that it doesn't hurt as bad, right? Now, when you say triggered into like severe episodes, that may be biochemical, right? That's not just a trigger, right? That is a biochemical change that likely happens. So I need you to separate the trauma and the psychological stuff that's going on and the biological thing that's going on as far as the severe mood swings, the likely bipolar diagnosis and stuff like that. Okay? And those of you listening, I want you to try to incorporate yourself into this story, because I can't speak to everyone with complex PTSD. I can only, because this is so intimate and so different for everyone, that's where the Mentally Strong method comes in. We figure out what are the things in your 10 categories. What are the things that you need to be doing and working on so that you can make choices in line with where you really want to go. All right. Next question was, how can I help myself process and release this trauma given that I internally no longer feel anger at my biological father? This happens so much with high functioning people. You're like, yeah, I had that trauma. I've dealt with it. That may be true on a superficial safety level, right? Safety is the first thing. Anger is a superficial emotion. But what's under that? Are some of these feelings of feeling mediocre, feeling like no one is going to love you for who you really are? Did that start during your trauma? Likely. So working through the different components is also how you begin to release that out of the body. Like, we know we need to release trauma, but knowing how that trauma impacted us helps us to release it. So looking at your thought map, there's definitely some things in there that likely started during your trauma. So that's the first step. Now, for anyone listening who has experienced trauma and you want to know, is it like seriously impacting me? And what do I do to release that? Is I want you to sit alone in kind of a meditative state, and I want you to tell your story of what happened to you as if you were in it, right? So in 6th grade, remember yourself in 6th grade and tell yourself that story. And as you're telling yourself the story, where do you feel it in the body? That's where you're holding it. It's still there. Some basic trauma release is breath work. Okay, let's say you feel it in your gut, feel it in your throat. There's some things I feel in my throat because I stayed quiet, right? Wherever you're feeling it, allow that feeling to be there and then try to breathe through it. Deep breaths, and you could do 4 counts in, 8 counts out. There's different types of breath work. But breath is the one thing that we have for ourselves. It is our healing tool that we have wherever we go. And so as you are telling your 10-year-old self, 12-year-old self, that story, wherever you're feeling it in your body, I want you to breathe through that. And consciously be thinking about this breath is releasing these things that are in my body. Now that I work in depth with trauma, and that is just a small thing that you can do at home. There's so much more that we could do with the trauma. But those are the 2 things you can do for yourself, right? You can identify how this trauma is still impacting me in my negative thoughts and my choices. And then do breath work to kind of try to release it. Next question. A physician recently informed me that I also have borderline personality disorder. Is it clinically possible to concurrently have bipolar 1, complex PTSD, and quiet borderline personality disorder? The straight answer is yes. But I want to be very careful with borderline personality disorder. Personality disorders are a continuum. And, oftentimes we're trying to find another label to help us understand ourselves. And that's okay. But I don't want you to own it. And personality disorders are just that. They're personality tendencies. We all have personality tendencies. It becomes a disorder when it's impacting your life, right? In isolation to these other things. So it is not the priority. If it's there, it is not the priority. So I want you to prioritize bipolar 1, complex PTSD, and then work on personality traits of a borderline that may be contributing to what's going on with you. Okay? Borderline personality has a lot of reactivity around relationships and connection, which you do have, right? But it's likely due to your trauma, not truly isolated borderline personality, right? But those tendencies of being reactive and kind of maybe clinging to people, then pushing them away, that is, something that you can work on, right? So borderline personality traits, I like to say traits, it brings insight into, okay, I need to work on this part of my personality. I don't want you to think of it as an isolated problem. It is, part of that complex PTSD as well, right? All right, next question. What is the most evident signs of a trauma response, or are signs that I'm actively being triggered by someone else's trauma or behavior? This is important in your case, and I think for many people, in that we're trying to equate every trigger with something specific, right? Triggers are these external things that happen that push an internal button. And that internal button may be your negative self-talk, and you have control of that. You can work through that, right? Now, if somebody is sharing with you about also being molested, or you see a news story of someone being molested around your age, and you have a flashback of your experience, that is a direct trigger to the trauma. But oftentimes the triggers that I talk about are triggers to our negative dialogue, which we have control over. And that is one of the categories that I identified for you of really working on that negative self-talk. And if you are trying your hardest to do that and you can't, then you may need medication, right? And I know you said you had stopped taking meds. This is a big problem for a lot of people. A lot of people listening are like, I don't want to take meds. I don't want to have to be that person. I don't want to have bipolar. I want to deal with my trauma and be the best version of myself. Both can be true. You can deal with your trauma, be the best version of yourself, but being the best version of yourself may mean treating your bipolar. Okay? So you are a whole person. There's so many things that are contributing. And everyone listening has a story. Your story is personal, and your story can fit into the Mentally Strong method so that you know what to do with the different pieces of your story. Their next question was, is this specific combination of conditions treatable? Absolutely, always. However, I do again want to reiterate looking at the whole picture of bipolar 1 likely needs medication. Complex trauma needs to be working through that trauma. Personality stuff needs to be worked on, but it needs to be worked on in relationship, right? And it doesn't have to be intimate relationship. You could start with, relationship with your family, trying to feel connected to your family. Last question. Is isolation okay instead of engaging myself in a crowd when I feel like I'm having attacks? In the midst of, actual episodes of whatever, yes, obviously avoiding crowds and avoiding things that are making it worse. But this is the catch. If all you do is avoid, are you actually getting better? Are you treating what is going on? There's something called a systematic desensitization, which is where, let's say you are afraid of crowds, and then you slowly go into a small crowd, a larger crowd, and you work your way in, right? If this is episodic, right, which it would more likely be associated with bipolar, we've got to treat that with mood stability before we challenge to engage in those things. So the answer is yes and no at the same time. The Mentally Strong method can help you. If you are still listening, you are probably struggling with something similar. And I say similar because everybody's story is different, but we can take the Mentally Strong method, help you think through what's going on, organize those thoughts, make choices in line with who you want to be so that you can be the best version of yourself. You can find purpose and joy and happiness. Click the link below to learn more about working with Dr. B.